everyone, welcome to another episode of the Anti-Pharmacist Podcast. Welcome to a new week. I hope you had a nice weekend, because I did. Yes, so today I've been thinking, what should I let my people know again? I just thought of it that, you know that there are many medications around, and there are times that you actually know from maybe previous use or just general knowledge what a particular medication is used for. But then you go to your doctor or you go to your pharmacist and you're given this medication for something totally different from what you know that it does. You know, some people may want to reject it that, I know this drug now, is it not an antibiotic? Why are they giving it to me for this particular condition? And that actually may prevent adherence, right? It may lead to inappropriate adherence, especially if you do not trust your healthcare provider. So I just want to let you know a few of these medications, okay, that actually have more than one indication, all right? And I'll tell you the science behind it, why it is so, and I'll give you examples. So that is what today's episode will be about, basically. Without further ado, like I always say, let's get right into it. First of all, the concept of a medication having more than one indication is called polypharmacology. And indication means the purpose for which that drug was prescribed or given out to the patient. That is the disease it is supposed to take care of. That's the indication. There are several reasons why a drug may be used for more than one condition. Okay, number one reason is the concept of receptors. This is the science of it. I won't be going too deep into it. It's just to explain it briefly so that you can understand. When drugs get into the body, they attach to some places in the body called receptors. It is these receptors that are responsible for their action in the long run. Now, a drug may actually attach to more than one receptor in different places in the body, and this is responsible for the action, like I said. So this can elicit various actions in various places in the body. I hope you understand that. Another reason is the concept of dosage. Okay, some medications have different actions at different dosages. An example is amoxicillin. If you give amoxicillin at 500 milligrams every 8 hours, you are using it as an antibiotic for some bacterial infections. Okay, but at 1 gram every 12 hours, you are actually using it to treat a particular bacteria called H. pylori, which affects ulcer patients. You see this? It happens in a lot of medications. So that is why we actually insist that you follow every instruction of your healthcare provider as given. Do not tweak doses, because you might actually be using that drug for a different purpose for which you do not need it at that point. So dosing is another reason for different indications of medicines. And another one is side effects. You see, side effects are seen as something bad, majorly. Most people see side effects as an unwanted action of this medication. But just like I said about receptors, which are targets in the body with which drugs elicit their action, some of these drugs bind to this target to elicit unwanted actions, and that is what we call the side effects. But now science has seen side effects beyond negativity. Side effects are actually a nest they are taking advantage of to treat major conditions. Okay, for example, some medications that cause drowsiness been taken advantage of to treat insomnia, to treat anxiety. Some medications that cause hunger, that have insatiety as their side effects, have been used to improve appetite in some people. I know you know what I'm talking about, because a lot of people actually take this medication. Do you understand? So these side effects are some of the reasons why medications now have more than one indication. The basic reason is biology, gender, sex differences. It could change indications of medication. Okay, something that is known to actually affect something in a man may affect something else in a woman because of differences in some organs or some hormones, right? So that's another reason. So a man can actually use a medication for a purpose different entirely from a woman. The reason for multiple indications of a particular medicine may be due to similarities of diseases. You'll be surprised how similar some diseases can be to to one another. I talked last episode about misdiagnosis, that you could take one disease to be another because of the similarity of symptoms. So some diseases are so closely related with similar symptoms, so much so that a particular medication may actually be used for both diseases. Do you understand that? Although there might be differences in the dosages or frequency or even duration of use, but then the medication could actually still be useful in this case. Another reason for polypharmacology is that, you see, science evolves, right? And medications do not always do what they're asked to do. Sometimes a medication is not totally studied, it's not completely studied. So the mechanism of action, how it works, is actually not completely known. So medications have a mechanism of action in another patient, you see it doing something else, then you have to study it over again. That is why there's post-marketing surveillance of medications, so that if it's doing something more than what the scientist knows, they are informed and they can carry out further research and scientific experiments on those medications. So that's another reason. For example, if you take a particular medication now and you realize that it's causing hirsutism, that is abnormal hair growth in the body, and you report back to your pharmacist, who takes it back to the drug regulatory body, the drug regulatory body calls the company that supplied the medication or that presented the medication for approval, and that contacts their research and development unit. From there, a new indication totally different from what was known can actually be discovered. Okay, so science is not a thing that is static, it is always evolving, it is dynamic, which is why there's reproposition of medicines right now. You take a medication, you realize the side effect. That's why I always advocate that you talk to your healthcare providers. And I've made an episode on this podcast about reporting of adverse drug reactions. Okay, so you can listen to that as a bonus to this, how you can take it back, so that you might not even know, you might be the next discoverer of an indication of a particular medicine. How cool is that? If you're actually observant, of course. So these are the various reasons for polypharmacology, that is multiple indications of a particular medicine. Sometimes these indications are called off-label use, especially for medications that the clinical trial have not been done for that purpose, and it's not in the leaflet of the medication that they actually use for that purpose. But it has been noticed due to post-marketing surveillance that they actually work for this purpose. They are called off-label use, and sometimes they are only prescribed as last resort, okay, not the first indication in most cases. You see, some medications that have been out of market have even been able to come back due to this concept of polypharmacology. A very good example is thalidomide, a particular medicine then that was used for morning sickness in pregnant women, but was discovered to cause birth defects. It was teratogenic. They were giving birth to deformed babies, okay? So it was banned. But years later, scientists discovered that it had indication in treatment of multiple myeloma, a particular type of blood cancer, and this drug was reintroduced into the population. Imagine that. Of course, those that made that medication then, they would have written it off. Oh, this is a wasted investment. But then 70 years later, it is now being used for multiple myeloma. Okay, of course, it will not be given to pregnant women, but those that are not pregnant or who are not looking to give birth can use it, and it will be beneficial to them. That is the concept of polypharmacology, and that is why science is very interesting. Now, let me go to some examples of common medications and their various indications, just for your knowledge. Okay, I'm not saying that you should now start going to ask for these medications. See your healthcare providers for advice. I'm just telling you that you shouldn't be shocked if one of these medications or another medication that I will not be mentioning today is given to you for a totally new indication that you do not expect. Just know that this is the reason for it, okay? And you can always ask questions. I'm sure your healthcare providers are ever ready to give you explanations to whatever it is that you do not understand. Nobody died from asking questions, right? I least not that I know of. This reminds me of one herb then growing up that they call awubahu. Yeah, that they will write so many indications on it and all of that. Although that is not a standardized medication, you cannot account for what is inside it, or at least a mechanism of action. So that is not advised, okay? But then I'm still looking forward to a kind of medication that will be able to treat a lot of diseases. It is a particular scientific fantasy of mine, okay? That maybe there will just be a panacea that will just treat a lot of diseases, if not all, and maybe I'll be the discoverer of it. Well, that's on a lighter note. Having said all of this, I'm sure that you understand the concept of polypharmacology now and why some medications are used for more than one disease condition. Now to the examples. I've mentioned about 2 or 3 in the course of the explanations, right? But then I have more, so here goes. The first one I'll be talking about are proton pump inhibitors, that is your omeprazole, your rabeprazole. So they're used for a condition called GERD, that is gastroesophageal reflux disease. But that's not the common indication. Most people know them as anti-ulcer medications, right? But GERD is quite different from ulcer, you understand? But they have similar symptoms. They are all characterized with, stomach pain, inflammation of the stomach lining, hyperacidity, for which these medications are very useful. That is number 1. Second example is your acetylsalicylic acid, that is what we call aspirin. At low doses, as low as 75 milligrams up to about 150 milligrams, it works as an antiplatelet, that is, it prevents blood clotting, okay? But at higher doses, 300 milligrams and the likes, it works as an NSAID, that is for pain relief. You see that? That is another example. Number 3 example is this popular medication, semaglutide. It is actually used to treat diabetes, to reduce blood sugar level, alright? But it was noticed to have weight loss as a side effect, which was beneficial for some people. And now it is being marketed for that purpose, especially in other climes, not in Nigeria, anyway, in the US most especially, for weight loss. It is known by the brand name Ozempic, and it has gained a lot of media attention lately. Another very interesting example is your phosphodiesterase 5 inhibitors, that is your sildenafil, your tadalafil, that are used for erectile dysfunction. Did you know that it was a serendipitous discovery that actually made it known that they could be used for that purpose? They were actually first marketed as blood pressure medications to reduce high blood pressure. But it was noticed that in men that used them, they got erection, and then it started selling. It wasn't even doing well initially because there were many blood pressure medications at that point. But when it was noticed that it worked for erectile dysfunction, they changed the marketing strategy, and now that is exactly what they are used for. The previous initial indication is not even what it's being marketed for anymore. It is now a drug for erectile dysfunction. Okay, another example, I think number 5 now, I've actually lost count, is birth control pills, okay? Birth control pills are believed to prevent pregnancies, but for some hormonal imbalances, like those that cause abnormal bleeding or dysmenorrhea, some of these birth control pills are actually indicated. They are given so that when next your doctor prescribes this and your pharmacist hands it over to you, you do not think that I'm not looking to prevent pregnancy, why are you giving me this? No, because they are indicated for more than one use due to the receptors, the targets, the hormones that they actually regulate. Another medication is gabapentin. It is known to be an anti-epileptic medication by some people, but others use it for neuropathic pain, okay? It's also used for mood disorders. Another example is the drug minoxidil, okay, which is generally known now to be used to treat hair loss, baldness, alopecia. But did you know that initially it was approved by FDA as a medication to treat high blood pressure? But now, hardly would you see it being used for that purpose. It is majorly now for treatment of alopecia. Another example is tamsulosin, which is commonly used in men for BPH, that is benign prostatic hyperplasia, that is enlargement of the prostate. But in women, it is used to treat kidney stones. It actually helps them to pass out the stones through their feces. You see, it's the example of the one I told you, that differences in sexes can actually explain different indications. Another one is nifedipine in pregnant women. Of course, it is used to treat high blood pressure in pregnant women to prevent preeclampsia, but at the same time, it helps to relax the uterus and prevent preterm labor in these women. So that is more than one indication, right? Yes. There's also tranexamic acid, which is used to prevent or stop bleeding, right? But dermatologists also use it to treat melasma, which is a skin pigmentation problem. Dexamethasone is also given in late pregnancy to accelerate fetal lung maturity. Okay, you know, there are some women that go into labor faster than expected. So in preterm babies, dexamethasone is given to accelerate their lung maturity. Apart from the fact that dexamethasone is a corticosteroid used to reduce inflammation, all right? And metoclopramide, the common drug for nausea, vomiting, is also used to treat diabetic gastroparesis. That is constipation, like inability to move bowels caused by diabetes. Also, colchicine, the common gout medication, is not only used for gout, it is used for gum ulcers, prescribed by dentists, also prescribed by cardiologists for pericarditis, that's inflammation of the pericardium, the tissue surrounding the heart. Metformin, the popular diabetes medication, is not only for that purpose, it is also used to treat polycystic ovarian syndrome, as well as in people who want to lose weight as well, because it has that as a side effect. And the antibiotic erythromycin does not only work to treat bacterial infections, okay, but it's also used in gastroparesis to encourage voiding of the bowel. You understand? It's a prokinetic agent, as well as azithromycin. Lastly, methotrexate. It's a cytotoxic agent. It is used in treatment of some cancerous cells. It is used in rheumatoid arthritis as well. It's also used in psoriasis, which is a chronic skin condition. So with all of this, you see that drugs can have more than one indication, and you know the reasons why, right? Polypharmacology is not the same as polypharmacy. Polypharmacy is taking multiple drugs at the same time, maybe for a particular indication or for multiple indications. It is also different from multiple dose combinations, in which you have more than one drug in one single tablet or capsule. All right, please know the difference. It is a drug branching out to treat different indications, different conditions, based on different reasons. Okay, so in all of this episode is to equip you with the information, so that it doesn't sound strange or look strange to you when you see a medication that you are used to being used to treat a particular disease, now given for another one that you are not aware of. Okay, in all of this, you must always talk to your healthcare provider and let them advise you appropriately before starting any medication. All right, that is what I have for you on today's episode of the podcast. I hope that you've gotten value. I know that you have gotten value. So do not forget to share, to like, to subscribe to the podcast on YouTube, especially, and of course on all your podcast hosting channels. Share. It is very important to increase the visibility of the podcast. And please do not just listen, like, and also leave your comments. Let me know in the comments if you have actually come across any medication, even maybe those that I have not mentioned on this episode, that you see that have been used for another indication that you are not aware of. Please let us discuss in the comments. Okay, and also follow me on social media. Follow Antipharmacist Podcast on Facebook, on TikTok, on Instagram, Also on X, I'm Farm Podcaster on X, and on LinkedIn, Bimisola DBC just says the name. Okay, ask your questions. You can message me for collaborations via email at antipharmacistpodcast@gmail.com. Let us collaborate. If you are a public health enthusiast, if you're a podcaster like myself, if you're creative, let's rub shoulders, let's share ideas, that will benefit our listeners and our followers. So thank you once again for listening up to this point and for your support thus far, which I'm counting on going forward. Till next time, stay healthy and God bless you. Bye.